All right. Well, welcome everyone. I hope everyone's having a most wonderful Tuesday. My name's Chip Pinard here with Rebels Against Aging, and it's such a pleasure to be here with you this evening for the Rebels Against Aging Healthy Hour. That's right, the Rebels Against Aging Healthy Hour. But I'm going to tell you what, right now, I'm going to just let you all know that we are not going to keep you here for an hour, although I'm sure Dr. Mike can go for an hour. We're not, out of respect for your time, we're not going to keep you here for an hour. But we got a wonderful presentation plan for you, or a Zoom plan for you here this evening in the Rebels group. And we just want to say thank you. Thank you for being part of this group. We really truly do care about your health. So real quick, what's this group about? Well, this group's about fighting the good fight of aging. I mean, not just from the perspective of our outer appearance, but also from the inside out. You see, guys and gals there's so many there's so many factors that contribute to the rapid aging process in today's world that a few of us, we took a stand, we band together, and we made the decision that
We're
we've
not
had it, we've
going
had
to
it, we've
take
had
it.
enough. Right. We're not going to take it. We put, we band together, and we made a decision that, we are going to rebel against the aging process. Thus, the Rebels Against Aging group was born. Now, what you can expect here in the Rebels group, if you're brand new to the group, or if you've been here for a long time, what you can expect is, we're going to share posts in this group ranging from, healthy ingredients, healthy cooking, workout, exercise, and also we're going to share, just keeping it real, we're going to share products that we're passionate about when it comes to reversing the aging process from the inside out. Products that we know produce results on a cellular level. Because, ladies and gentlemen, if you're not producing results on a cellular level, you're not producing results. Why would you want to take a product? So, and also just to taking better care of our bodies, because guess what? We only get one body, so we want to make sure we're taking care of that. So what we want to do is we want you all to enjoy the group, engage, ask questions, and we want you to live happy, live healthy, and live young at heart. So we just want to say thank you for being part of the Rebel group. I've been passionate about nutrition and health and wellness for the past 16 years now. And, I wish I would have known back when my parents were alive what I known then. I think I could have helped them, but they abused their bodies terribly. And they died way early from causes that probably could have been prevented. But with what we know now, that's what we want to do here in the Rebels group. We want to be able to share these things that we know work, and to be able to help you, reach your health goals and optimize your health for longevity so that you can live a long life. So again, thank you for joining us here this evening. We're not going to waste any more time. I'm going to pass it over now to Shelly in Kentucky, and Shelly's going to come on and share a little bit, and then we'll bring Dr. Mike on. So Shelly, the floor is yours, my dear.
When you said that about your parents, it's like I love my mother more than anybody. And she struggled so much. She had lupus. It took years before they diagnosed what was wrong with her. That woman worked so hard. She got up every day. She did what she had to do, went to the doctors. It was just like this roller coaster. And they never could figure out what it was. And then they said, well, it's lupus. You're just gonna live with this. You're just gonna deal with it. And my mom was kind of open to nutrition and supplements. Her husband, on the other hand, said, I'm going to go with what the doctor says. And so anything that I would bring to her, and I can't wait to hear what Dr. Mike has to say about this. Anything that, we would suggest that, hey, mom, maybe you need oxygen, maybe you need this, maybe you need that, I'll buy it. It's not like I'm asking you to pay for it. She would say, okay, I'll take it. Her husband said, nope, we're going to go with what the doctor said. And so it's frustrating because, you know, we look at our parents and we look at our loved ones and we're like, gosh, they're caught up in the medical game of what they're supposed to do and what they're told to do. But tonight we're here to talk about, you know, heart disease. And heart disease is definitely the leading killer of men and women. It's crazy because every 36 seconds, I've talked for how many minutes? Every 36 seconds, somebody dies from cardiovascular disease. And the thing that gets me is when one heart stops, hundreds of others break. You know, any of us drop dead right now, gone. There are hundreds of other people that love us, and those hearts break when one stops. And so we just got to look at this and be like, are we going to open our minds? Are we going to be open? And, most doctors, and not taking anything away from the medical profession, because they spend a ton of money, they put a ton of time, they go to school, they get educated, and they are there to help people. But a lot of times they're not looking at some alternatives and some things that we can do. So I am excited. I would move to Mississippi for this one reason, to have Dr. Mike as my doctor. Dr. Mike is a family practitioner. You've been at it, what, 22 years?
That's right.
Been in the industry 40. You've been practicing medicine, and we're anxious to hear what you've got to say, because you've been taught all these things and you have your knowledge, and I'm sure you treat your patients to the best of your ability, but you're also open to healing the body and giving the body nutrition. So we want to bring you on today and say, why are you recommending Clear Heart? What are you seeing with your patients? Why aren't you just putting them on meds, which most doctors do? So I'll turn it over to you.
Well, thank you very much, Shelley, and thank you, Chip, for having me here tonight. You're right, Shelley. The medical profession in this country, even though we have advanced tremendously, has sort of ignored a lot of the preventive things that all of us need to be thinking about, because it's great that we have the technology we do, but with the system the way it is structured, especially in an insurance-based system, it's all about treating disease after it happens. Nobody really focuses their attention on the preventive aspect. And so we go decades, 10, 15, 20 years, sometimes before that heart disease actually manifests in a way that you're going to get treated for it. And so I've been in the healthcare industry since 1984. I graduated from college with a degree in medical technology, spent 12 years working in clinical labs around the Memphis, Tennessee area, and went back to medical school a little bit later in life, and sort of knew at that point that I had a passion not just for coming out and doing the status quo, but really focused on healthy living, nutrition, lifestyle, all of those things. And so in my practice over the last 22 years, I have incorporated a lot of nutritional supplementation, a lot of counseling, a lot of advice. We focus on trying to help our patients take a little bit more of a path toward maintaining health, instead of just waiting until things fall completely apart and then trying to fix it. So even though we have some great fixes out there, if you can avoid that, by all means, you need to be looking at how can you avoid that. So what I'd like to do tonight, I'm not going to take up a ton of time, but you've asked me to talk specifically about the Clear Heart product, and I have had some amazing clinical experience with Clear Heart now in my practice. And I want to share a little bit of that, because what I want this talk to be for most of you is just very practical advice, something that you can potentially integrate yourself, or if you're working closely with a physician that's open to listening to you, I'm going to give you a few tips about some things you might want them to help you look at from a laboratory standpoint that would give you a little more insight into your specific heart health. Now, that being said, let's clarify this. The most important things I think that you can do also, one is you need to be cleaning up your diet. Sugar is not good for us. It tastes great, but it is one of the most inflammatory substances that most of us put in our mouth. So we really need to focus on trying to limit our sugar intake. We need to focus on trying to limit gluten intake, because all of these foods create inflammation in your body. And it's not that if the inflammation caused a problem right now, if you went to McDonald's, ate that Big Mac, and before you got back to your car, you had your first heart attack, you'd make that connection that, man, I can't eat McDonald's because that stuff's going to kill me. But when it takes 10 or 15 or 20 years for those processes to unfold and plug up an artery, increase your cholesterol, wreck your blood sugar, then we don't always make that connection. But anything that you can do to clean your diet with adding more fruits, vegetables, lean meats, lean protein, those kind of things is very beneficial to decreasing the inflammatory state that's going on in there. The second thing, and I have this talk less and less every year because people have awakened to it, but cigarette smoking is one of the worst habits I think that anybody can do, because of all the damage that happens at the cellular level. The oxidative stress that gets put on your cells is horrible. The damage that happens inside the lungs is horrible. So cleaning up your diet, cleaning up your lifestyle, moderating any alcohol intake, getting more activity, all of those things are just, we need to be doing all of that. All of us do. But when it really comes to more of an active preventive state, I think that where we miss the boat a lot of time is we do not really focus our attention as healthcare providers on the benefits that people can get from high quality nutritional supplementation that helps you just fill in the gaps. Because 50 years ago, if we were raising our own food, growing our own food, farming our own food, we had a high quality product. These days, the food that we are buying, the food that we're getting when we're not raising it ourselves, is oftentimes very poor quality. It's nutrient deficient. It's loaded with chemicals. It's loaded with pesticides. And all of those things impact how your body can process and handle and manage the repair mechanisms that have to happen for us to not rapidly age. And that's sort of what we're after with some of these things. When it comes to heart health, I will tell you this: if you have a physician that is open-minded, there's a few things that I would suggest that most everybody have checked from a blood work standpoint at least every couple of years. First and foremost is what is known as an NMR lipid profile, where they actually analyze particle size. It's not just your basic lipid profile. That one's fine for monitoring, but when you really want to look at risk factors, an NMR lipid profile helps your physician sort of see if you're at high risk because of particle size and those kind of things when it comes to cholesterol. The second thing is a test called apolipoprotein B, or ApoB, another risk factor. So if it's elevated, we already know you're at a little higher risk of cardiovascular disease, and you need to be focusing on that. A third thing is homocysteine levels. And finally, I am a big fan of doing a cardiovascular or cardiac CT scan with a calcium score at least about every 5 years or so, because it is a very inexpensive way to actually get a good look at your coronary arteries to see if you are already laying down early plaque inside those arteries. And if it is, you can monitor that more closely just by doing a few tests. So in respect to that, if you can actually look at some of those things, it just gives you a better picture of where you are. Now, when you throw in lifestyle issues, you throw in family history, then you can really get a better picture of what's going on, where you're at on the risk spectrum, because what we are doing in our clinic with Clear Heart is we are actually using it to help us manage and decrease patients' risk factors when it comes to developing heart disease. So from that standpoint, let's transition to Clear Heart. Clear Heart is actually one of the best supplement products I think I've ever seen in my 22 years of clinical practice. because in the first month of using Clear Heart, I could see changes in patients' blood work where we were checking these things and monitoring. So anybody that comes into my clinic that's sort of high risk, we do a little expanded profile. And then I usually bring them back in 4 to 12 weeks after putting them on the supplement and recheck all those labs. And it is amazing how much of a reduction we see with this one product on board. So I have been just flabbergasted and taken aback by how effective Clear Heart is. I've seen it lower cholesterol levels. I've seen it lower ApoB levels. We've seen it lower homocysteine levels. That combination of B vitamins that are in there actually reduce an inflammatory response significantly and actually help start reducing these things. So those are some things that I think everybody should pay attention to, everybody should look at, and have an honest conversation with your provider. I mean, yes, you're going to run into a lot of physicians who are just closed-minded as can be about supplementation. But just because they're closed-minded doesn't mean you shouldn't be using some things, because most of the supplements that are out there, if taken at the suggested and the recommended doses, are probably not ever going to harm you. They typically only offer benefit, not detriment, unlike a lot of the medications that we prescribe. And that's one of the reasons I've sort of shifted more toward natural alternatives, is because every medication that I prescribe has two issues. One, most of them do not actually fix the underlying problem. They only alter the symptom pattern. So they're being used to treat symptoms. Now, there are some good medicines out there that make some cellular changes and that actually help us improve. But many of the medications we use are not really getting to the root cause of what's going on. They're just there to cover up the symptom patterns that are presenting and help make the numbers look better, in the hopes that if we can lower some of these numbers, we may slow down some of the process that's developing. I have seen some of the supplements that I have used actually not just slow down, but honestly reverse some of those processes so that they completely normalize. And that's what's impressive to me about the quality of the Great Life Worldwide products. They are amazing. We'll talk about some other products in some other sessions, but I've got story after story after story of patients who have seen tremendous benefit from most all of these supplement products. So when it comes to your health, I don't want this to sound ugly, but nobody is going to care more about what's going on with your health than you. You are your best advocate. And if you're not getting the feedback that you need from the people that are trying to be your healthcare providers, you need to have open communication, or you need to move on to someone who is willing to listen to what's going on. Because there are lots of good things out there, and there is no place, in my opinion, for people to just close their mind and say, this is it. And I hear that story all the time in my clinic. Someone will go see this physician or that physician, and they told me, I'll ask them, why are you still taking this? And we don't know that you even need this. Well, Dr. So-and-so said, if I didn't take that, not to come back. And that, to me, is not the way medicine should be practiced. As a physician, excuse me, I am an advocate for you. My job is to help you understand what your options are, and then allow you to work with me to make the most informed decision you can that works for you, not that works for me. Because I can tell you all day long what's out there and what's here, and you actually have to decide what you can do, what you can't do, if it's something you want to look at, if it's something you're not. I mean, that's what a physician's role should be, is as a personal advocate, to take the knowledge that we have out there and help you make a better, more informed decision. So, with that being said, I hope that all of you are having good experiences with your healthcare. But I want you to really understand that trying to get away from prescription medicine in our environment is very difficult. Once a pill gets started, nobody ever wants to stop it, whether you need it or not. So you have to make sure that you're taking that role to say, hey, I don't understand why I'm taking this. I'm not sure I need it. I'm going to put it aside for a while. I hope you get your physician's blessing. If not, put it aside anyway, see what happens, and then work forward from there. Because it's amazing how many times I have seen, especially in my elderly population, patients that come in, they're on multiple meds for different things. Sometimes they're duplicated meds because they're going to 3 or 4 or 5 different specialists, and they don't even know what they're taking. I take a little white pill. I think it's for my blood pressure. No idea what they're really on. And that's sad because many of those patients, when we start unloading those medications, get dramatically better. I had a physician when I was, even before I went to med school, actually, I was doing some clinical research with him, and he made the point. He was a toxicologist and an MD. And his point was, when anybody's taken more than 3 medicines, I guarantee you there are interactions that are negative and detrimental. So pay attention to what you're on, how many pills you're taking, and make sure you understand the side effect profile, because every benefit that you get from one of those medicines is going to create some potential side effect. And you need to be aware of that. You need to be focused on the fact that when you have a new problem arise, ask yourself the question first and foremost, is this being caused by something I'm already doing, or is there something new going on in my life? And if you will let that guide you, you will come to realize very quickly that many of the medical problems that we deal with each and every day are actually inflicted by the medications and the things that we are doing that we're not even aware of we're doing. So that being said, I hope this information is beneficial. I'm going to turn this back over to Shelly and Chip and let them run with it from here.
Oh my goodness. I'm just going to say real quick, we're moving to Mississippi. Everybody is moving to Mississippi. We need Dr. Mike. Yeah, I texted you about a month ago because one of my very close friends went through a breast cancer situation, and she did everything they told her to do, and she went back in and they said, okay, you're clear, you have no more cancer. However, we want you to, get set up on this radiation treatment. And I said, are you kidding me? They just told you you're cancer free. Why in the world is the doctor telling you you've got to set up these treatments? And I said, let me text Dr. Mike. That does not make no sense to me. What in the world? I said, I'm not going to say her name. I said, don't do that. Please don't do that. You're cancer free. Why are you going to let them poison you? And I texted you and you said, no. There's no reason for that. But it's sad because when we're sick or our loved ones are sick or they get these diagnoses, we tend to listen to what the doctor says. My stepdad said, no, your mom can't take that. I'm going to listen to what the doctor says. And then you watch them die because of what the doctor said. And it's like, so God bless you, Dr. Mike. God bless you. Thank you. Thank you for, you've got the knowledge, you know what you're talking about, and you will treat people as they need to be treated, but you're not going to push the poison. You're going to look at the individual. So I'm just like, man, I'm moving to Mississippi. Chip, back to you.
Well, thank you so much. And thank you, Dr. Mike. Appreciate you big time. Thank you, Shelly. I just want to get real with you guys for a minute because, Clear Heart to me has been a life-changing, if not a life-saving product. I have dealt with severe high blood pressure for years. And this goes all the way back to my 30s. I'm going to be 60 in August. And at one time, my blood pressure was spiking 220 over 130. My resting average was about 158 over 100. And at one time, I was actually on a cocktail of 5 different pills. But in order to get me, and this is what really made me start taking a look at what is going on. Again, I love doctors. I mean, I love doctors, but just some of the way that they're gripped by the pharmaceutical companies is just mind blowing. Because the one doctor I had, the one cardiologist I was working with, it was every time I was coming in, he was giving me a different sample and it was just, it kept going on for like 6 months, different sample, different sample, different sample, different sample. And some of the side effects that I was getting were, I mean, scary, but to the point to where it felt like muscles were falling off my bones. Some were giving me night terrors. And then they finally got it worked down to 5 pills, but I didn't want to be on 5 pills for the rest of my life. So I decided to start taking some action and doing some things, changing some diet, exercise. Dr. Mike hit on it, making that dietary change, cutting out that sugar, cutting out, the big one for me was cutting out the sodium. Sodium was really whacking my system. And then, eating healthy, eating right. But I was able to eventually get down to 1 pill, but that still to me wasn't good enough because I've been on this pill for so long. It was starting to uh to cause some problems, some memory loss, and some other things, that I knew that I had to, if I wanted to live out the rest of my days happy, I needed to get rid of this 1 pill. So, I when we came into here into Great Life Worldwide, and we were formerly, and many of you on this know that we were formerly American Dream Nutrition, and I was introduced to Clear Heart. Even at that time, my blood pressure was starting to spike back up. And I can tell you this, after being on Clear Heart for 2 months, it's been 2.5 years now, my blood pressure, my resting average has been 100 over 70. 100 over 70, all the way from what, 220, 230. I mean, they thought I was going to have a stroke. They pulled me off of work and everything. They ran every scan known to man, and they never ever really came up with a cause. They just said I have abnormally high blood pressure. And it was a battle, but it was a battle that we've won. Now, again, I just need to throw this out there. I make no medical claims or anything. We make no that treat, diagnose, cure anything with Clear Heart. But I do know, and Dr. Mike can even attest to this, that when you provide your body with the nutrition and the supplementation that it needs, your body's capable of doing some really, really amazing things. I just wanted to share that with you. Again, Dr. Mike, thank you so much. Shelly. Now we're going to transition into you all. We just want to say thank you for taking part in our giveaway. We're actually going to be giving away here tonight. We're going to give away 5 bottles of Clear Heart. We had over 40 some odd people register for the drawing, and we just want to get this product into your hands because we want to see you have a result. So with that being said, I'm going to share my screen real quick here. All right, let me know if you're seeing my screen. Give me a thumbs up, guys. Are you seeing my screen? All righty, very good. Well, let's grab the wheel here. And Shelly, if you could write these names down for me while we're drawing these names, that would be awesome. So I'm going to shuffle the deck here. Again, we just want to say thank you. Thank you all for being part of Rebels Against Aging. We've got a lot of things planned moving forward. I know we kind of been silent over the last little bit here, but we're back in the saddle, and we just want to educate and help you all to be able to optimize your health. So with that being said, let's give our first spin of the wheel here. And our first winner is Penny Diane Faulkner Sills. That's Penny Diane Faulkner Sills. We're going to remove her name. We're going to shuffle the deck again. And we're going to spin the wheel. Round and round she goes. Where she stops, I guess we'll find out here in a moment. All right. Our next winner is
Cannon Fort.
Cannon Fort. Cannon Fort, you are the winner of a 1-month supply of our amazing Clear Heart product. 3 more to go. Shuffle the deck again, and here we go. Our next winner is Joanna Lynn McCreate. Joanna Lynn McCreate. You are the winner of a bottle of Clear Heart. That's 3, 2 more to go. Shuffle the deck. All right, here we go. Winner, chicken dinner. And our next winner is
Ooh, right on the
Kiki
line.
Kiki El Shabazz. Kiki El Shabazz. I hope I'm saying that last name right. You are the winner and our 5th and final winner here as we shuffle the deck is Rhonda Clark. Rhonda Clark, you win a free bottle of Clear Heart. And ladies and gentlemen, when we give these things away,
Congratulations.
there's no strings attached. I mean, I'm going to keep it real. We do hope that you see a result and that you do order these products. But if not, that's okay. We just want to truly see you have a result on these products. So there you have it, ladies and gentlemen. I'll be posting the names of the winners over in the Rebel group. Hey, Dr. Mike, any closing thoughts here tonight before we get out of here?
No, nothing that we really haven't covered already. I mean, I think the biggest thing, if I can get people to understand, is don't allow the healthcare industry to push you around just because they can. Take a stance. It's your health and you need to protect it. So whatever you have to do to protect your health is what you need to do. And I hate to say it, but sometimes that's leaving or walking away from a medical clinic that's just not willing to listen to what you need. But that's about all I got.
Okay, thank you, Mike. Dr. Shelley, Shelley, any
Dr.
final thoughts?
Shelley.
Any final thoughts?
No. I feel so fortunate and blessed, that we have what we have and that we have people like this that we can reach out to, and we have products that we can reach out and help people that we love. That's, they say
Right
if you want to
on.
make a living, help people, and that's what we do. So
Right on.
congratulations to all the winners. This is awesome. Thank you, Dr.
Congratulations,
Mike.
winners. Yeah, thank you, Dr. Mike. Thank you, Shelley. And I'll just leave you guys
Thank you, guys.
with, you're so very welcome. We'll leave you with this, just to kind of give you guys a heads up. The month of May, we're coming up into May. May Day is tomorrow. We are going to be focusing our primary focus is going to be on the Phytazon product. And I'll tell you what, Phytazon is the ultimate in anti-aging, and Dr. Mike will have plenty to share on Phytazon on our next healthy
some
hour.
amazing stories about Phytazon already.
All right.
Can't wait.
Can't wait for that. So again, thank you all for taking time out of your busy schedule to join us here for the RAA Healthy Hour. And I leave you this thought. Remember this, folks. Life is full of choices. And the choice you make today to take your health into your own hands, it'll definitely shift your tomorrow. Thank you, everybody. Have a wonderful rest of your day.
Bye, guys.
Bye for
Bye.
now.
Bye, guys.